Hello, everybody. Welcome to today's webinar called Updates and New Federal Stimulus Funds for Childcare Impacted by COVID-19. Before we get started, just a quick housekeeping. I would like to go over a couple of items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone call or computer audio. If by any reason you would like to change your selection, you can do so by accessing your audio pane and just selecting that option on the control panel. This webinar is being recorded. All participants are placed on mute for quality assurance, and you will have the opportunity to submit your text questions to today's presenters by typing them into the questions panel on the control panel. Please feel free to send those questions in at any time. We will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. Now, I would like to turn this over to Kathy Glazer, who is the president of the Virginia Early Childhood Foundation. Thank you.
Thank you, Stan, and welcome to everyone. Very glad to have such a large audience of interested stakeholders and friends. We're really pleased to be able to offer this briefing today so that we can all learn more about the new federal stimulus funds that Virginia has received to support child care programs that are impacted by the pandemic. Our agenda today will flow as follows, as you see on the screen. First, we'll hear from Virginia's First Lady, Pam Northam, who will share greetings and comments. And then Jenna Conway, who is the Chief School Readiness Officer for the Commonwealth, will provide the briefing detail. And then she and Tara Ragland, who is the Director of Licensing Programs for the Virginia Department of Social Services, will be available to answer your questions. We look forward to a really productive hour and a half. And with that, it is now my honor to welcome our First Lady, Pamela Northam.
Good afternoon, everyone. It's so great to see you. I thank you, Kathy Glazer and VECF, for having us today. I really appreciate everything that the entire early childhood community is doing today. You all are really stepping up when we need you the most. You know that always we know that you are our superheroes out there. I've been traveling 5,000 miles across the state of Virginia to raise the profile of the incredible work that you do and to talk about the talented professionals that you are. And I know that you have been courageously and tirelessly working to support and reassure our children when they need it the most. And we are so appreciative of you all stepping into that role. The governor and I know that that means sacrifices for you and your own families, and we truly, truly appreciate that what you do really helps to keep the entire community safe, as well as let the caregivers make sure that we're caring for those who care for us by taking care of their children. So thank you so very much. Many of you know that I'm a pediatric occupational therapist and an educator myself. And so this has been something that's been so important to me to work at expanding access to quality early childhood care and education. We had a very successful General Assembly session, and we're thrilled to think about all the great things that are going to be coming out this year, despite the challenges most recently. Over the past 2 years, my team and I have been working really hard to make sure that you get what you need, really to, in the end, ensure that our children get what they need as well. Both are so important to us. And it's been clear, the more we travel and visit with you all and sit down to listen, that you all are the most important part of Virginia's early childhood and early learning system. We could not do it without you, and in these days it's more evident than ever before. Everyone I talk to who's at home with young children right now really recognizes, if they hadn't before, your amazing superhero talents. I know these are really challenging and unprecedented times, and that's why we fought so hard to get that $70 million out to you as soon as possible. We really appreciate our friends like VECF who are helping us with this. And I will let the experts, Jenna Conway and Tara, explain more about the details. But I do want to assure you again, you all are on the front lines of comforting our children right now. They really, truly are looking to the adults as their schedules have all changed and the world has been upended like ours. You are the people who give them comfort and show them that we care and everything will be okay. We have a strong Commonwealth, our children are resilient, and we will get through this together. So thank you for everything you're doing to make that happen. I want to introduce to you someone very special to me. She has been the general in charge of all of our work in early childhood, nationally known expert Jenna Conway. And she really fought hard to get these funds to you as quickly as possible. She works out of my office and is leading the transformation of Virginia's early childhood education today. And she is also the mother of 3 young children herself under the age of 6, so she knows from whence she speaks. She has already expanded access to thousands of Virginia children since starting in this new role 2 years ago. And despite the difficulties, I'm really looking forward to seeing what she's going to be doing in the near future. So I wish you all the very best. Stay well, and thank you again from the very bottom of our hearts. The governor and I truly appreciate everything that you all are doing. Thank you so much.
Excellent. Kathy, can you hear me?
Yep, you're all set, Jenna.
Excellent. Thank you. And thank you, First Lady, for those kind words. Thank you, Kathy, and the Virginia Early Childhood Foundation for hosting this webinar today. Thank you to the more than 500 folks who have logged in from across the Commonwealth. I think this is the largest webinar I've been on so far this week, and really very appreciative for people to take the time to get an understanding of what we are doing, across the Commonwealth to support our child care sectors. I wanted to echo the appreciation expressed by Kathy and the First Lady to everybody on the phone. We are roughly a month in to this, and for some of us it feels like a year, some of us it feels like a century, but certainly the world has changed a lot since mid-March. And I think before jumping into the weeds of the content today, I want to acknowledge that some of you are open, some of you are closed, but everybody has had a difficult experience over the course of the last month. It's unprecedented, it's extraordinary. We've all heard these words, but emotionally, operationally, practically, it's been really, really hard. And just wanted to reflect that and know, as we start to kind of get into the details, as the First Lady noted, this is so hard in part because you all are so essential. Those of you who are staying open and serving the children of our essential workers, without you, our hospitals wouldn't function, our grocery stores wouldn't function, our buses, our mail wouldn't get delivered. And so I want to recognize, for those of you that are closed, we know that that's heartbreaking. This isn't about months of work. This is years and years of building a center or building a program that in a matter of days or weeks seem to slip away. And you are missed. You miss your kids. You miss your teachers. And as I can attest, I know the kids miss you. As the First Lady noted, I am the proud parent of small children, including a 4-year-old who was that 4-year-old who was never excited about sort of childcare or preschool. She's at a center right now, and she was often the one who would wrap herself spaghetti or octopus style around my legs, and quite a bit of drama when trying to get her back to school on a Monday morning after a long weekend or after a holiday, and really just sort of wasn't her favorite thing necessarily, and yet without fail these mornings, like clockwork, at 7 o'clock, somebody crawls into my bed, puts their face right next to mine and says, can I go to preschool today, right? Can I go to preschool? Is preschool back open? And so that's my daily reminder of, kind of how essential you are to the hundreds of thousands of young children across the Commonwealth. And know whether you've got smaller enrollment or whether you close, that this is just such a tough time for everyone. And that there's simply nothing, no Zoom, no GoToWebinar, no Google Hangout that can replace what your educators, what your programs provide to our young kids and to our families in the Commonwealth. And so just wanted to acknowledge that, that sort of sadness and that challenge, as we kind of go through this together. With that said, I also know that you are essential now and you will be essential in the future. And so I steadfastly, in the same way that my daughter every morning comes in and says, "Is it open today?" know that we will reopen. As the First Lady noted, our kids are resilient. Our educators are resilient. You are resilient, and we will come back. And so we see this constant communication, thanks to partners like VECF, as one of the important steps as we take an understanding of where we are today. We sort of figure out how we use resources that are available to us to solve problems as they're popping up, and sort of be as strategic as possible. And ultimately that each of these activities is a step towards short-term and long-term recovery and bringing back our programs, bringing back your educators, making sure that my kids and kids across the Commonwealth can go back to school and preschool and our infant and toddler programs, and that you all can thrive again. And so that, that is the overarching spirit through the guidance today, as we sort of think about each of these as baby steps towards recovery. What I'd like to do with my partner, Tara Ragland, our Director of Licensing, is take you through what we know about where we are in the Commonwealth today, some of the data that we see at the state level, so you can understand, okay, how you sort of fit in with that, and then some of the concerns that we're hearing from the field and how we'll use the CARES Act or the stimulus funding to address some of those concerns. We'll then open it up for questions, answer those that we can answer, and then make sure to keep a record of those that we can't answer, because I think in partnership with DSS, we've already started, I would know this is my third of 3 webinars today. We're getting a lot of questions in, and we'll be producing a frequently asked questions, or FAQs, in which we make sure that there's one place where you can get all of your questions answered. So with that, can we move to the next slide? So where are we today? And I think this is important because sometimes when we're in our homes, or if we're in our center and we're sort of at half staff or much smaller size, we can feel very alone. And so wanted just to start with sharing the current situation, the data that we know about the Commonwealth today. So as of just a few days ago, as of April 15th, obviously it's a very different landscape than where we were in mid-March. As all of you know, all of our public and private K-12 schools have been required to be closed through the remainder of this school year. So really from kind of March 13th through to June. Child care centers are allowed to remain open, but many have had to close, whether it's for the safety of their employees, whether it's because their parents kept kids at home. There's a variety of reasons. So what we know is that as of April 15th, 63% of our child care centers are closed across the Commonwealth, and nearly the same percentage of our religious exempt or faith-based preschools are also closed. So the majority of our larger facilities, our child care centers, and our religious exempt preschools are currently temporarily closed. We know that more of our family day homes are able to remain open, smaller settings, vitally important to our families and communities. And so right now about 1 in 4 have temporarily closed, and the rest have either not reported to us or remain open. This is a significant amount of closure across the state. So roughly 2,700 child care programs across the state closed. And for a point of reference, that represents a loss in capacity of nearly 200,000 slots across the state. So big numbers, right? 1.2 million kids out of school under the age of 12. So that kind of age point in which you need care and supervision, and a significant loss in terms of capacity or slots across the state, over 200,000. Wanted to clarify a couple of important points, right? So we've got a lot of closures, right? The majority of places, at least our larger centers, are closed, but childcare is allowed to be open. Our governor at several points has noted that childcare can remain open. None of the stay-at-home or other executive orders require you to close your doors. You do need to comply with those orders and making sure that you don't have group sizes of more than 10, that you're keeping those groups separate, but really sort of noting that childcare, is allowed to remain open because we know that it's desperately needed for our essential employees. We also recognize that our child care educators are themselves are essential personnel. And so I just want to kind of note that, recognize that you are continuing to enable our society to function by staying open and serving child care. We recently, as of I think it posted at the very end of last week, and wanted to make sure everybody is aware, we know that sometimes that's not clear out in our communities, that you're allowed to remain open, or that your educators are essential personnel, or that your work is essential. And so collaboratively, and you'll hear throughout Tara's and my sort of presentation and comments today that we've done a lot of this collaboratively with the governor's office, with the Department of Social Services, and with the Department of Education. But we put out a letter indicating that you are essential, you can remain open, and that you should be a priority for critical supplies like cleaning materials and other things. We know there's still a challenge, and I think the governor put out a request to the federal government yesterday. There's still sort of a shortage of supplies in the Commonwealth across the board, but certainly where there might be resources locally, making sure that you've got that letter and can advocate for them. And, we are trying to kind of, through phone calls, through communication with the field, through webinars like this, to stay abreast of what the most pressing issues are. So that letter is an example of things we were hearing from our providers that were remaining open, that they were either having folks saying to them that they should be closed, families weren't clear that they could remain open, or that they were having difficulty when they went to their Walmart or their Kroger getting supplies. And so again, that letter was an example of how we are responding to the field. And as I will talk about through the remainder of my presentation, trying to make sure as we inch by inch, hour by hour, day by day, work through this crisis, continue to be responsive. So that's where we are. A lot of kids out of centers, out of schools, at home. We also, I should note, have a lot of unemployment in the state, a pretty dramatic landscape, both in terms of who's staying home with their kids now that they no longer need care because they've been permanently or temporarily unemployed, or as you also heard from some centers this week, where families are saying, I can't afford childcare right now. Everybody's incredibly anxious about their financial circumstance because on the heels of a public health crisis, which created concerns about health and safety, came a sort of an extraordinary economic crisis, which has sort of led to high rates of unemployment, or sort of folks going on either permanent or temporary unemployment over the course of the last few weeks. So that's the current situation. We have, over the course of the last 4 weeks, tried to kind of get out and hear to folks, mostly virtually. Obviously, we're also working from home, social distancing, and what we're hearing are there really kind of two key areas that we need to sort of consider as a priority when we think about our collective work across government. The first of which is making sure that there's enough emergency childcare for the peak and duration of this crisis, and we'll talk a little bit more about that in a second. And how do we support the most pressing financial needs in the field? And so the kind of focus there was, how do we take these new resources made available to the Commonwealth as of this week, $70 million in some CARES Act childcare funding, to support you and to address what we hear are the most pressing concerns from the field. So these are the two areas in which I'll talk about in our presentation, and that Tara and I can take questions about, but wanted you to know, as it stands today, here's where we are in the Commonwealth, here's what we know, and as I'm about to talk about, here's what we're going to do about that. Next slide, please. So as I noted before, the initial numbers were very concerning. We've got 1.2 million kids under the age of 12 who are no longer in schools, right? We know that we've closed more than half of our child care centers and faith-based preschools, and 1 in 4 of our family day homes, with sort of removing 200,000 slots from the system. And so when we then measured that against, how many essential workers we knew in our health and hospital system, our first responders, and that broader set of essential personnel, including childcare educators themselves, but grocery, sanitation, UPS, postal office, bus drivers, all of the folks who ensure that our society continues to function, we were deeply, deeply concerned that there would be enough emergency childcare across the state. The governor got did a press announcement and encouraged folks to stay open if they could and prioritize essential personnel. In partnership with VECF, we've done at least between 15 and 20 phone calls and meetings with Smart Beginnings across the state to understand what's happening locally. We talked to municipal governments, we talked to school divisions, we put out guidance to kind of make sure that there was enough. And I will say, as of today, April 17th, whether it's in response to social distancing and everybody doing their part to flatten the curve, right, to kind of stay home where possible, to limit group sizes, to wear masks, to wash hands more frequently. Right now, we don't see a crisis in any area of the state in terms of emergency childcare. And so again, huge sigh of relief. We are, and wanted to emphasize this point, the governor has noted it in one of his previous press announcements. We emphasized this to the Child Care Association earlier this week. We are encouraging folks to first go to the experts. So when you think about emergency child care, first go to those programs that are remaining open, whether child care center, religious exempt preschool, family day home, right? Those who know how to deal with kids, right? Those who know the health and safety, who understand the development of kids, that we know that even our programs who are remaining open are saying, hey, I've got half empty classrooms, I've got, slots to spare. And so that's our kind of message, but wanted to let folks know, at least as it stands right now, we are not saying that there's a crisis anywhere in the state. And in fact, across the board, folks are reporting to us sort of partially empty classrooms, even if they are open. And so wanted you to know that. I also wanted to sort of thank our social services partners and Child Care Aware of Virginia in particular, who helped us quantify what we were feeling, right, which is that there's a real concern about emergency child care. Everybody has sort of been working locally to figure out what was going on. And Child Care Aware of Virginia this week published a new map so that you can see who's opened, who's closed, kind of get a sense of what are centers, where are family day homes, what does this mean in terms of capacity? Are there other things that have opened to provide emergency child care? How does that relate to hospitals? So that if you're sort of, contemplating locally, should I stay open? Should I reopen? What's happening in my community? You can go to your map and get a sense of what's happening locally and kind of, where you are in terms of capacity. I should note, when we talked to some childcare providers earlier this week, you might go on that map and find that your information isn't accurate. And so encouraging folks, even if you're not looking today, but to go on, check, make sure that the status for your program is accurate. And if it's not, to let Child Care Aware know, either 866-KIDS-TLC, or you can go to vachildcare.com and you'll see the web address at the bottom of the page there. But this is a great new tool for providers to know about, for families, community planners, us at the state level, to kind of get an understanding of what's open, what's not. And then again, making sure that we are encouraging where needed families, community leaders, and others to go first to our expert, to our child care program. So I wanted to make sure everybody is aware of this. And make sure that if you check this and your information is inaccurate, that you go to Child Care Aware, but to say, at least as it relates to priority one, that you all are doing a great job, and that those of you who have remained open, whether big or small, are helping us with this flattening of the curve, ensure that we have enough emergency child care. I'd say, everybody should recognize that we expect with the flattening of the curve that we're going to continue to need this for a while. And so again, as we kind of go to recovery, we're going to want more and more folks to come back online. But we are hopeful that we are going to be able to manage enough capacity across the state so we don't put our first responders, our nurses, those folks who we need to clean our hospitals and to staff our grocery stores, that we'll have enough essential personnel to be able to work through the duration of this pandemic. And again, this tool is a way to track that over the course of the pandemic. Next slide, please. So I talked about where we were as a state, kind of the challenges that we were facing. I talked about the two priorities that we are taking on in response to that, one of which is ensuring there's enough emergency childcare, and talked about some of the work we've done to quantify that, and then highlight a new resource, this new map that everybody can use in their communities and as individual providers to keep track of who's open and who's closed, what capacity looks like kind of across the Commonwealth. The second priority that we have as a state is addressing kind of what's happening in the sector, right? And so if you go back and you think about the economic implications of what does it mean to lose 200,000 slots, right? And then if you think of a kind of a kid roughly costing kind of $1,000 a month, and many of these slots have been closed for over a month, it's like a $200 million kind of financial impact across the sector, just across the sector, right? Not even accounting for the higher cost of infant and toddler care, not even accounting for the higher cost of operating during these difficult times. And so we hear you loud and clear. We know folks are having to make very difficult decisions. We know and want to sort of do a shout out to Virginia Early Childhood Foundation, Child Care Aware, other groups that have done webinars to help you make sense of the other resources out there. And I'm always going to encourage people to kind of pursue every possible resource because even as I'll talk about today, the CARES Act funding can't solve for the entirety of the financial loss that this sector has experienced in the last month. But we hear you loud and clear that things are really hard right now. You've either had to close and put teachers on unemployment or furlough, something that's devastating to do considering your years and years of dedication to this field. Some of you are open, but are finding it much harder to make payroll and make the dollars and cents work because you've got fewer kids in classroom, additional costs of cleaning, paying your staff more to come in because they're concerned about their own health, safety, and welfare. And so we hear you. And in response to that, one of the things that we've done, and which Tara and I'll talk about, is try to figure out with whatever resource we could get our hands on, how could we get that out to the field as expediently as possible. And so what I want to talk with you now about is the CARES Act. This is the Corona Aid, Relief, and Economic Security Act that was passed by Congress and enacted just at the end of March. This was $1 trillion package, so there's a lot of aspects of it. Part that goes to schools, part that goes to governors, part that goes to unemployment. What we'll be talking about in this webinar is the portion of this funding that explicitly is intended to support childcare. And so this act provided Virginia with $70 million that goes into the Child Care and Development Block Grant funding for this year. This means that this funding is explicitly intended to support the child care sector, the parents of young children who folks have to work, and again, sort of a broad definition of essential personnel, healthcare, emergency responders, or sanitation, or grocery. We know that folks need childcare during this period of time. This funding is intended to support our subsidy program, in the strong belief that we needed a subsidy program before this happened, needed a subsidy program during the duration of this, and we'll need a strong subsidy program as we recover, making sure that we, across our states can sort of sustain our child care subsidy programs so that programs can stay open or reopen, and making sure that our providers are supporting their educators to the greatest extent feasible, and recognizing that normally the focus of the Child Care and Development Block Grant is the subsidy program, but in this extraordinary time, really encouraging states to think beyond the subsidy program because the sector as a whole has been so devastated by this pandemic. It's important to note that this funding does not require matching funds from states, does not fall under requirements, so there's a little bit more flexibility than we typically have. And so folks might say, well, we should always do it this way, right? Kind of always move this quickly, always kind of fund this broadly. But this is a rare opportunity where the federal government gave us more flexibility than they typically do to really be able to meet your needs. And so we want to just to note that. I also want to do a huge sort of shout out and a note of appreciation to our partners at Social Services who have been working behind the scenes for the last few weeks to kind of gauge what the needs were, to understand what might be coming in terms of the federal relief, and then to really quickly work with the Department of Education and the governor's office to turn around this package. There are very few times in my experience in the public sector work, and I've done it for a number of years now, where a state gets the dollars. I think the dollars hit the state bank account on Tuesday, and the governor did a press announcement on Wednesday. And I can guarantee you that nobody on this phone did that work overnight, but it really spoke to incredible work, particularly on behalf of Commissioner Duke Doran, Tara, and the others at the Department of Social Services who've just been really working to figure out within the parameters provided by the federal government, how do we get these dollars out there? And thanks to that collaboration, we're able to kind of get those resources out there. And, as you've seen, the application's already online. I do want to note, and before we kind of get into the detail though, that moving that quickly normally means two things. One of which is there's always going to be some bumps, right? I mean, we are, as you often hear the analogy, we're building the airplane as we fly, right? Anytime you move that quickly, and we wanted to do that so we could get resources out there. But it does mean that, there will be some bumps along the road as we implement it. It also means that we likely have forgotten something or omitted something, or sort of, didn't realize some impact of something. And so we are appreciative, whether it's through the questions that we get today, whether it's follow-up feedback, to the Department of Social Services, to myself, that if we've missed things, that we can go back, we can reflect, we can figure out if there's an additional way to provide some flexibility or to flood resources. So we don't see that what we have today is the end-all be-all, right? We wanted to move with urgency because we knew you were hurting, but we also recognize that we'll get feedback from you on what's working and what's not, and then we'll likely have to kind of come out with additional guidance, additional resources as we continue to work together to move through this pandemic and towards recovery. Next slide, please. So what were the goals? When we reflected to the governor, here's our collaborative proposal on how to use this funding urgently and expediently to help the field. What were the key goals? And so these goals relate to what we were hearing directly from you over the course of the last 4 weeks. I think first and foremost, we heard that folks who were open were really struggling. And they were saying, you said we're essential, you asked us to stay open to serve essential personnel, but it is really, really difficult to stay open. It's hard to get staff, it's hard to stay clean, it's hard to kind of make all of this work with smaller group sizes. And so the first priority for the CARES Act child care funding was to get resources to those programs that are open now or want to be open in April, May, or June. And to not have that be limited just to programs on subsidy, but more broadly to those open programs with a kind of direct cash assistance grant that is based on program side rather than just kind of how many kids are showing up. So that was goal number one. And as I'll talk about second, the single biggest portion or pot of money is to support those providers who are open to serve children during the pandemic. The second thing we heard was for those families who are part of the subsidy program, right, or some of our most vulnerable families, those who are still working, right, and whose kids can't stay home, are essential personnel, right? Again, and whether that's folks who are keeping our hospitals clean, staffing our grocery stores, whatever the variety of things, really finding it hard to make ends meet, right, as everybody is, and wanting to make sure that they were supported. And so sort of taking care of their co-payments, right, to sort of really support those folks who are having to go out of the home and work harder than ever over the course of this pandemic was our second big priority. And so families in the child care subsidy program will not have to make co-payments from April 1st to June 30th, and that will be provided directly to providers to kind of give those families, our essential workers who are out there working so hard right now, some relief, right, particularly our most vulnerable families who are on the subsidy program. The third thing we heard was, although our first priority was serving those folks who remain open, we heard from subsidy providers who had to close, whether it was because they couldn't get staffing, whether it's because some of their families needed to stay home and they couldn't make it work just on the kind of the families who remained. We all know how difficult the economics of running a child care program are, or because they just felt like that was safest. Whatever the reason, we know that a good number of our providers had to close temporarily. And we knew that there wasn't a way, to kind of get absence payments, which is a sort of a way of paying for enrollment. if they were closed. And so although the state kind of offered some flexibility to programs that remained open, adding an additional 40 absence payments for those programs, it didn't didn't a month ago offer that to closed programs. With us receiving this additional CARES Act funding, we recognize that we need a subsidy program, right? We needed to be strong in order for families to have options and have access across the birth to 5 and even before and after school age spectrum. We need a strong subsidy program, and so we wanted to make sure with the additional funding that we got resources to our providers who are in the subsidy program, even if they had to be temporarily closed. And so those providers who've been closed will now be eligible for those additional absence days. I think roughly it's about 40 absence days, which is kind of like paying for enrollment for 8 weeks for our subsidy programs that are closed. You can manually submit those. There's more details on the DSS website, but again, wanting to recognize all of our subsidy programs as it's really kind of critical to the overall ensuring as a state we provide access and letting you know that you are now eligible for more absence payments, able to use those resources to prepare to come back, and then potentially open as soon as you're able to be able to serve our subsidy families as well as the other families you may serve. And lastly, again, as I noted before, although we don't have any urgent need to kind of create pop-up or backup, emergency childcare, at least as we sort of see right now in the state, at least at a statewide level, we know that certain communities are responding in different ways. We wanted to make sure that there was a pool of money available if we needed to supplement schools or other facilities to kind of open up backup emergency childcare if there wasn't enough capacity in the private sector. And so I use the analogy when I've talked about this, as folks might have seen on the news, when they stood up a hospital in Central Park, when they brought the ship from the Virginia ports up to New York City to kind of serve as a hospital ship, kind of these very temporary, not ideal kind of backup scenarios where if we all of a sudden there was a peak or an outbreak in a particular area and really needed to open up some classrooms quickly, wanted to make sure there was a pool of funding to support that in schools. We are seeing that in a few areas across the state, although on balance, we think thanks in large part to those providers who are remaining open and the work to flatten the curve and social distancing is that, we are hopeful that we won't need too many of these pop-up centers, and instead we'll be able to use the existing capacity in the private market to support this need. So those are the goals. I wanted folks to kind of understand a little bit of the background before we got into the details of the programming to sort of say, why did Virginia approach it in this way? First priority, those programs that are remaining open. Second and third priority, supporting our families on the subsidy program, as well as the sort of broader subsidy program itself. And then the final and kind of last priority is making sure that we could, if needed to, turn on emergency childcare and sort of more broadly in sort of settings like schools across the state if and when a kind of a community had an emergent need. Next slide, please. So, and I've got Tara on the phone too, can add any commentaries we kind of get into the details. Wanted to then spend, time talking about why I think folks joined us today, which is to find out about the kind of particularly the funding resources available for our open programs. So as I noted before, the big ticket item or the sort of largest single source for this CARES Act funding that goes to childcare is for supporting open childcare centers. It's not limited to programs in the childcare subsidy program. Our licensed child day programs, our religious exempt child day centers, licensed family day homes, voluntarily registered homes, as well as any of our subsidy providers are eligible for this new grant program. And again, we call it a grant program, so it's a direct to center provision or direct to family day home provision that's not tied to any particular kids attendance or any particular sort of day-to-day enrollment. The way we have structured this program is to provide that kind of direct cash assistance, and so to really set the funding levels based on size rather than attendance, knowing, as we've heard from you, how that's gone up and down over the course of the last few months, and that nobody wants to be put in a position where you kind of, have to make someone attend in order to receive resources. So eligible programs will receive a monthly payment based on a kind of a calculation that will be the same across the board, which is 25 times half of your total license capacity for each of the weeks. And so this gives you kind of an example here in terms of walking you through this, right? So if you had a total capacity at your site, if your license capacity was 50 kids, or your total capacity was 50 kids, your grant amount would be 25, half of that times $25 per week, or $625 per week, or about $2,500 for each of the months you're eligible for. And you'll need to apply for each of those months, April, May, and June. And that's the kind of the current proposal that we've been permitted to fund. So it'd be a direct cash. You can use it on what you want to use it on, whether that's cleaning supplies, whether that's hero pay for staff, whether that's just to kind of help make ends meet, whatever you want, you can use it on. And again, there's questions about kind of calculating it. The application is actually attached as one of the handouts for this one, and in there it gives you an email address or a number you can call if you've got sort of particular questions about how to calculate it for you all. But I think the key point, it's based on your size, not on attendance or enrollment, and that you would be eligible for each of the 3 months provided you meet the following criteria. So you have to be open for the month applied for. Again, right now this is limited to April, May, and or June. You could do 1, 2, 3 months, right? So again, just depending when you're open. You have to be providing or willing to provide childcare for children of essential personnel. And so I know there's been endless questions and conversation. Are they essential or not? We are not asking you to go in and sort of provide documentation of who of your parents are essential or non-essential. We don't want to kind of, folks to get into a long conversation about sort of defining that. If you're open and you are either providing or willing to provide care, and that willing means you might think that your folks are, your parents might be non-essential, but you're willing to provide care for essential personnel. That is what we're looking for. We want to keep it simple. We don't need documentation on that. We just need you to kind of attest to that you at least, if you don't have any essential personnel, that you're at least willing to provide them. And that is, again, important. We're not trying to kind of split hairs as it relates to that. We just need centers to be open, right? So that, if a parent calls 866 Kids TLC, there are options in their community. I need to comply with the enhanced health and safety requirements. And again, nothing sort of surprising here. We've been closely working with the Virginia Department of Health, the Centers for Disease Control. So you'll see kind of a page and a half in there that just says, these are the things we need you to do to keep yourselves safe, to keep your educators safe, to keep your kids safe. And it's, again, kind of best practices in response to COVID-19, really making sure that we are trying to minimize the spread for those programs that have to be open. And you need to apply. And so I think that's an important point. This is not something where it's not like the stimulus, it's not where the sort of checks are going to be cut and just go out to programs. You will have to apply for the month that you want to seek. You'll have to fill out the application. It'd be really important we do that. We know that you guys are dealing with a lot of stuff right now. You're dealing with applying for PPP, you're applying for EIDL, you're applying for loans, you're, figuring out kind of, sometimes you're still collecting from parents, right? I mean, we know there's a lot going on. However, because of the unique nature of this, and this is the first time we've done a grant program like this, everybody has to apply. We have to create a paper trail and make sure that we demonstrate these things, in order to use this funding. So please make sure that you apply. If you know of colleagues who might also be eligible, they also need to apply. But these are the kind of key criteria. It's included in the letter that went out to the field. It's included on the website. But be open in April, May, or June. Be providing or at least willing to provide care for children of essential personnel. Comply with the enhanced health and safety requirements, right, which again involves checking a box and then attesting or sort of committing, saying you will follow those, and then you got to submit the application.
Jenna, can I interject real quick?
Yes, jump in, Tara.
So this is Tara Ragland. So I wanted to jump back to what you said a little earlier about patience with this application process for CARES. So we've received, since the governor's announcement, over 1,000 applications already. And so what I want to stress, and I'm glad we have so many folks on the phone because I think it's a good way to get this information out, is that we have, a group of folks that are manually having to enter this information and receive this information. So your patience is going to be of the utmost importance to us. So we are working very diligently. We have an awesome team of folks that are, trying to get all this stuff entered and ensuring that you guys get this funding in the most expeditious way possible. But again, we need a little grace because there is a whole lot to getting this information, getting it in, and then turning it around and getting it to our finance folks and having all that information. And we are seeing that some folks are asking us in their email requests to call them. And, again, we're probably anticipating over 3,000 applications. So I don't know that, we're trying to keep it to email if at all possible, but just, again, we just really appreciate your patience with that. So it's very exciting that we have this process or this opportunity, and we're very excited about being able to be a part of it. But just wanted everybody to kind of understand that it is a manual process. So I would thank you for your patience on that.
Yeah, thank you, Karen. And that's, again, the exciting thing, right, is that of the 1,000 folks who have applied in just a few days, I think, as folks have also noted, that's also the challenging thing. And again, we know that that folks are sort of facing similar kind of challenges around applying for other things. And I want to echo Tara's point around, we'll be patient with us. I think the good thing I can say, at least as I understand it today, and Tara, correct me if I misspeak here, but unlike some of these other places where, they sort of said apply now because we might run out, and I think we've seen a little bit of that with some of the Small Business Administration things, at least our calculations based on what we understood is that there should be sufficient funding. So again, get those applications in, know that our, colleagues at Social Services are working through those right as quickly as possible. It's a fairly simple application. Clearly it doesn't take that, much time, right? Because folks got them in quickly, which is great news. And we're very thankful to Social Services for making it such an expedited application process. But, I do think that's an important reminder that ultimately for government to cut checks, it does take some time. And, know that, we are committed to kind of getting those dollars out to you, but really appreciate the patience. That's a good segue if we want to move to the next slide, and folks can kind of get a little, although it sounds like at least a third of the sector already knows what the turquoise application looks like, as it probably will become known soon enough. But so that gives you in the bottom corner here, for those of you who haven't seen it, that gives you a kind of copy of the application. Here's the details. Here's where you find it. It's also in the handout for the webinar. Here's where you ask about it. For those of you who have questions about subsidy, I know that our partners, Tara and my partner, Barb Newland and Sherry Dorsey, and the folks on the subsidy program did a webinar with local social services offices and regional folks this morning. So they're gearing up to prepare some of those changes on the subsidy program, whether it's, my case is suspended or what about this. But so for those, email them directly at Vendor Services or reach out to them, reach out to your local social services offices. There's kind of questions or concerns there, but they are making sure they're working in the same fast way that Tara and team are to kind of make sure everybody knows if you are a close vendor that you can now apply for these manual absence payments. You don't need to get a signature from parents, like if you can't get the parents, right? If there are things you need to do to address that, if you are open and your parent already made their co-payment for April, but you know that the DSS is going to pay for it, how to handle that. So again, if you have questions about the subsidy program, you have that email address and website there. As it relates to schools and emergency child care, those are routed to us at DOE. You can email the superintendent's email address, and we'll get to that. And again, if there's any concerns for families, if they have about the copay or other pieces, this is the link for them to go to, or as always, they can go to their local Department of Social Services. And we know that that's been coming up. I lost my job, my situation has changed, and so again, referring folks back to their local Departments of Social Services is the best guidance that we've heard in terms of being able to provide guidance to families. So with that, Kathy, I think Tara and I are probably available to take questions. I know we've only got Tara for a little bit, so we'll make her the priority, but we'd love to see what questions we get. I will note on a webinar I was on earlier today with some of our social services offices, I think it's important to note, in the same way that Tara asked for some grace and patience, I think we also you might ask us questions that we don't know the answer to. And what we'll do is we'll keep track of those. I think neither Tara nor I want to give you a wrong answer. And because this is new and we are building this as we go, there might be ones where we need to defer and get back to people through the FAQ.
Understood. Thank you, Jenna. And we look forward to hearing from both you and Tara around questions. And we do recognize that Tara needs to step away at 2:30. So we'll get started and see how many we can attend to. I think we'll start with questions that are specific that folks have about the application process or about the grant details, and then we'll shift to other more general questions. First of all, will funds be available weekly or monthly?
So I can answer that question. They will be, we're going to be cutting checks on a monthly basis, just because that's kind of the way social services does most of their payables. So it makes it a lot easier. I think if we had to do it weekly with 3,000 folks and it being a manual process, it would be very difficult. So it will be on a monthly basis.
Understood. Are school age programs eligible, and can their population be included in the $25 per half population calculation?
So I don't think we have an age limit regarding school age children, do we? I think we are. That's part of the process of who we desire to serve. Am I correct on that, Jenna?
Yep. Yeah. My understanding was just the capacity to whatever the kind of physical capacity is, regardless of age.
Right.
All right. Can you answer questions about timing? On what dates does this need to be submitted by for the April funds, for example?
We haven't really put any deadlines on this. And, as we've kind of walked through this in the last couple of days, I think some of that was intentional because we understand with everything our providers have going on, we're trying to make it as easy as possible. I mean, basically what we're saying, we'd probably like to see that if you're asking for funds for the month of April, that you probably get your information in no later than May 15th. But we don't really have a deadline, just understanding that there's, just a lot of difficulty. If you have been open for the month of April and, I think, we're going to be pretty reasonable about the time frame.
Gotcha. And then a few more about that. Do they need to submit monthly? And can they submit all at once for 3 different months?
You can, and it's preferable, and I don't know, I think that may have been one of the things that may not have been clear on the application. If you check April, May, and June, you do not have to resubmit the application. If you're unsure of whether you're going to be open, say June, and you don't check June and then you're open in June, then you would have to go back and resubmit. So it's probably easier just to check the boxes for all 3 months.
Okay. And then do they need to send a W-9 if they already have an EIN? Can they just send the EIN number?
We are required to have a W-9. That's what our finance folks are telling us.
Okay. Are religious exempt programs eligible?
Yes.
Thank you. This is like lightning round. Thank you. Will they be able to verify that the application has been received? In other words, do they get some kind of confirmation that they've submitted appropriately?
Yes, there will be. However, it is not going to be prompt. So it's not like you're going to get them in the next day or so. Like I said, we've got a group of folks doing these manually. And so it's going to take, and I wish I could say how long. We've had a couple glitches with our system already in terms of we've got a lot of folks that are sending in pictures. And so we've actually, I'm just kind of giving you a glimpse behind the scenes here. We've had to order licenses for Adobe DC Pro just to be able to split out some of the stuff that we're getting. Again, we're trying to make this as easy for folks as possible. So we literally have folks taking pictures and emailing them in. And so it's kind of difficult for some of our folks to be able to capture this. So, there might be a few delays, but we're hoping to get the acceptance letters out, hopefully within a week.
Okay. And is it they are able to apply now?
Yes, everything's, like I said, we've already received over 1,000 applications, which is just absolutely incredible. So I think it's just amazing that we've got, that ability to have folks apply so quickly.
Yeah, and we're really meeting that objective to try to get cash out quickly. If we hope to open by June, should we fill out the application now?
Yes.
Would priority for funding be given to programs that have been and continue to be open?
I probably will say no, because we're just kind of processing these as they roll in. It's difficult to batch them in terms of, who's been open the longest. We obviously are, checking to make sure folks, do that, we have information on our providers, but we're not really able to batch them in terms of who's been open the longest or that type of thing. But I will say that most of the folks that we've received, just from my cursory review of the process, is of the 1,000, I think probably 90 to 95% are currently providing services. So
helpful. And then back to the W-9 issue, Tara. If we're tax exempt, do we need to send a W-9? And is 147C an alternative to W-9?
So if it's there are alternatives. You can do your social security number. I would just say that when you submit your application, if you are exempt, to make that known and we can contact you. I've put in I have an email in with some questions for our finance folks now, because we've had that question come up from some folks earlier today. And so, we understand that they can provide their social security number, but they also, when they do that, need not put the name of the actual center. They would need to put their name on the application as well. So you would reference the name of the center, but then you would want to make sure that you had your name if you're using a social security number.
Thank you. Will funds be deposited directly into our accounts or mailed?
We will be mailing checks.
Let's see. If the center has already applied for a small business loan from the feds, are they still eligible to apply for these grant funds?
I believe so.
And let's see.
Looks like Kathy, one thought to add to that, just to echo Tara's point. With our best understanding of the federal guidance here, this is structured as more of a quality grant than as a direct payment for any particular child or service or use. So again, I think neither Tara nor I want to give, individual tax or legal advice, but these are we're considering these kind of quality grants, right, and sort of recognition of being open. So, I think there's quite a bit of flexibility there, but note that it's not tied to any particular kid. It's not tied to a certain attendance. you know, you've got flexibility in how you use it and account for that, and want folks to know that. So it is, you know, a sort of a pretty unusually flexible sort of source of dollars. You'd have to sort of talk to your own accountant or whatever else as you're, you know, applying for these other things. But it is, you know, it is not tied, right, to one particular use. And so, you know, use it as you see fit, but, you know, make sure your accountants know about it, but it shouldn't interfere with other things.
Thank you. Tara, we're going to ask you one more question and then let you go. If we're a multi-site organization, can we submit one application?
That's a very good question. I don't think I've even thought about that. I think it would probably be helpful if it was submitted individually, just for accounting purposes. I think that might be a little easier for us in terms of how we are accounting for this. So if it's hugely problematic, let me know, but if at all possible, you could do it individually by center. I think that would probably be best. I'm thinking our accounting folks would probably feel like that would be preferable.
Okay. Thank you, Tara. If you need to go, we appreciate your being here. If you can stay on.
No problem. I've got a few more minutes. I have a telemedicine appointment, so you know they call you, you know how it works. So.
All right. Is there an application deadline, and is there an application in a paper format for those providers who are not technology savvy?
So the application can be, I mean, you know, you have to pull it off the website right now, so it can be printed and faxed in, or you could mail it in. I don't know if we had I'm sure if you just mail it to the main address, I'm not sure if we had put that on the site or not, but I'll be honest, what's working best is when folks fax these in. It really is, for whatever reason, it's a little bit more legible, and we're not having the issues that we've had with some of the folks that have tried to scan it in or process it online. So you can print it off and fax it.
Okay. There are a few more questions. I know y'all have addressed this, but let's just see if we can clarify. I think some of these questions are being asked a little bit differently. Can we apply for funds anticipating our reopening date in June, or do we need to wait until we're actually open? And another question similar, should we apply now with the plan to reopen later?
I don't think that there's a problem with going ahead and letting us know that. If you think that it's going to be June, just given the number of applications we're getting, I may hold off a week or 2 weeks just because of the number that we're getting in. So it might be just easier for my team, but you know, we're not about what makes it easy for us. So whatever's better, I would say, for you in anticipation of what your needs are.
Thank you. Would we need to be open the entire month to get the funding?
Jenna, I believe so, don't you? I think it has to be for the entire month.
Yeah, that's what the current, you know, it says during, right? I mean, and again, I don't, you know, there's not a splitting of hairs. I mean, the importance, right, the incentive is for folks to be open and available. So, I mean, if you've got to close for one day, I don't think it's a big deal, but the goal would be to be open for as much of the month as possible.
And Tara, would you remind folks again, once the application is approved, let's see, how quickly would we find out if the application is approved? And then when would the funds come?
So we know it's probably going to be at least a week before we can probably get these letters out, the approval letters. And we anticipate, and please don't hold me to this. I don't want you to take me to the guillotine if this is not what happens, but we anticipate that the first checks that everybody should receive, their first checks by May 15th. That's our goal. So again, we may need a little grace on that if we run into any issues or whatnot, but sooner, hopefully. But that's kind of the deadline we've given ourselves. So again, we know everybody needs these funds, and so if we can get them out more quickly, we will definitely do that. We just don't want to put a deadline that we're not going to be able to meet. So we'll say May 15th, and if it's earlier, then maybe folks will just be really happy with us.
Okay. Thank you. And Stan, maybe let's go back to the slide. We're seeing a lot of questions about where to find the application. Where do we get the application? There you go. Thank you very much. Let's see. So we have a number of questions from folks from the Fairfax area about permitted providers. Is this money available to permitted providers in Fairfax and City of Alexandria?
So I go back to kind of to piggyback on what Jenna said. This doesn't, we don't have any limitations basically on who can apply. So I would say you are open to apply.
Thank you. What will happen to the funds saved for backup emergency childcare if they aren't used? And I think that's probably for the school divisions, Jenna.
Yeah, I'll take that. So I think more broadly, it's always a balancing act in terms of wanting to kind of, get these dollars out the door. We have a ballpark for each of the pots of money. And I sort of noted that the single biggest one is going to the open providers. These are, thanks to them being a block grant, there is some flexibility, and they could be repurposed if they're not used. What that would involve would be going back right to the governor and kind of proposing an alternative. So I don't think we would do that immediately. I think we want to get a little further into April and May and have a better understanding of what the kind of pressure will be on our health and hospital system, what we sort of because these models continue to evolve. But if they're not used in any of these areas, then the nice thing is we can work with the governor and with Commissioner Storin to provide an alternative plan. I think we would sort of do something similar if we got additional resources, right? We'd kind of come back and look at what resources are there and how we might use them. I'd answer the same question as folks have, I know, already are sort of saying, well, what about July, right? We're already hearing now that some of this might go into July, or I think the other one we've heard, Kathy, is that this is not like a light switch. Like it's not going to, all of a sudden the sector's not going to be back on June 11th. And so, we wanted to focus most immediately on what we were hearing was the concern, what the numbers or the data indicated was the concern, and to kind of focus on this 90-day period of April, May, and June. But I expect we will look at what has been spent and what hasn't, what the evolving needs are from the field, and then come back with, okay, here's what, round 2 might look like.
Gotcha. Thank you. Our university childcare is eligible to apply.
Yes.
Can we print the grant application form, fill it out, and email it or fax it in?
Absolutely.
Thank you. And then a clarification about the receipt of the funds. The funds that you receive on May 15th are for the time open in April, and the following payments will be in the same manner. Is that correct?
Yes. So the May 15th funds will be for April, and we're hoping, because the big crunch is trying to get the applications processed, get everybody into our system for payment. And if anybody's ever had to do payables with the state, there's a whole lot of paperwork that has to be done to be able to account for what we're doing. So once we get the batch headers completed and we have all the stuff done for the initial April payment, it will make May and June a much easier process for us. So, we could possibly even see that those payments go out more quickly after the first payment. But it's just trying to get all that stuff in, and I have our finance folks, make sure everybody's present and accounted for, so to speak, and have all the paperwork aspect done, which is pretty litigious. But we'll, May and June will be much simplified.
Thank you. Will we pay tax on these funds?
Ooh, Jenna, that's a good question. I think because it's a grant, I would say, I don't know that I want to answer that without, double checking that. Maybe we should,
Yeah.
We'll
Maybe
double check that
I-
and get some,
it-
put that in the FAQs maybe.
Yeah.
Thank you. That'd be great. Couple of questions about, that just sort of reflect the uncertainty for a lot of these providers. What if we apply and then decide not to reopen because COVID increases in our community? Or if we're not in a position to take on new enrollments, can we still apply for this grant?
So I would
Jenna?
answer the latter one first. Yeah, I think the latter one, and I'm just going to sort of say it one more time, and it's probably a little easier for me to say it than Tara, like, being open is what we are focused on. So if you are open now and you are willing to attest that if, somebody needed it in terms of essential personnel that you'd be available, then you're eligible. And I think that's the goal here is to support the programs that are open or willing to reopen. We feel very strongly that in order for our essential employees to continue to have access to care and for society to recover, we need to recognize those folks that are open. And so we've tried to make that language as sort of open and sort of as flexible as possible, but you just need to read the language in the application and make sure you're comfortable with it. And, as I said before, you don't have to actively be serving, a police officer's child or a doctor or nurse's child. You just have to be open and willing to serve anybody who would be essential personnel during these 3 months. On the second one, I think that's a little bit tricky. I mean, I think, Tara's point earlier is we're trying to be flexible on kind of folks being open in months. I mean, again, that all of this is evolving. I think if you're not sure if you're going to reopen, I might wait and apply, knowing that, there's not really a system to prioritize, but we obviously want the dollars to get out first to those programs who are, are open now. If for some reason you apply and you realize that, you're not able to open, then I think you just, you email them. I mean, this is, the advantage and disadvantage of a manual process, right? The disadvantage is it's slow. The advantage is that at least, if for some reason your circumstances change, I think the state can work with you to try to reconcile that. But I do think folks should only apply when they're either open or very serious about reopening, because the goal of this program is to get programs open or ensure that they remain open.
Thank you. And just to double check from someone, will the funds be allocated for the weeks already open in April since we're halfway through?
So we have decided that we are going to make the funds retroactive to April 1st. So if you were operating on April 1st, then you will receive the entire amount.
Excellent. Thank you. There's several questions about just making sure that the fax number is noted on the application. Is that something y'all can double check or verify?
Yes, we can double check that.
Thank you. Excellent. And just a number of questions about sort of if the month has, between 4 and 5 weeks, does that matter? Are funds allocated for 12 or 13 weeks? There are 13 weeks in April, May, June. Is it full month, in other words?
Yeah, I think we're paying for the full month, I believe.
Okay, thank you. And just needing reassurance, can family day homes apply?
Yes.
We were closed 3 days because a staff member had contact with a positive coronavirus case. We needed to clean up and sanitize everything. Does this affect our application?
I think that goes back to Jenna's point earlier that, if it's, just a couple days, I don't think we want to penalize folks for that. I mean, and especially given, that there's probably going to be some cost for that. So I think, that's one of those opportunities for a little grace on our part. So I think, as long as we're not seeing it probably, go past 3 days or something like that, I think we would be okay with that. You think, Jenna?
Yeah, in fact, I think there's some language in there too, right? If you do have these positive contacts, there's a set of things you have to follow as it relates to that, including the sanitation. So yeah, I'd agree. I think if you were following best practice and there was like a had to close circumstance like that, you'd still be eligible.
Jenna, will there be support for childcare closed that do not have subsidized family clients?
That's a great question. And I actually, you know what, I realized, Kathy and Tara, I forgot my kind of current, sort of earlier disclaimer about that the $70 million does not solve, sort of the full magnitude of the financial loss experienced by the child care sector in the Commonwealth. And again, if you use even my kind of analysis of how much, potentially sort of was lost in finances, and that's just the programs that were closed. That's not to speak to all of the places where, parents opted out. And so we're talking about hundreds of millions of dollars lost last month, right? And this is only 70 million. So that's a way of kind of explaining that while there has been some loss by our private providers, that in terms of the having to make hard choices and the prioritization for the block grant, and looking at the parameters or the expectations set out by the feds, that's how we landed on those four. So programs that are open, programs subsidy families, programs that take subsidy, and some kind of backup funding for emergency child care were the top priorities. And so they're, at this point in time, short of their, unless the kind of additional dollars are made available, there's not really any resources for private programs that are currently closed or remain closed. If any of those programs are able to open, later this month, May or June, then they would be eligible for that open grant, but there's no resources slated for private programs that remain closed for that period.
Thank you. Is there a hotline or a helpline for these types of questions as folks begin to complete their application?
So I would just recommend that you email the askforcare@dss.virginia.gov if you have questions. That's probably the best way to get answers to anything that you have.
Thank you. Super helpful. It's great y'all are providing that. Does a public school operating emergency or backup childcare have to be licensed to be eligible for the grant application?
Jenna, I'm trying to go back in the recesses of my mind to remember that. I believe they do.
Yeah, I think there's sort of the two pots of money, and again, I think if there are sort of individual questions, we can work with folks on there. If you're licensed, right, you're kind of a community provider in a school, you'd be eligible for the open one, right? And you could do that now. If it's just a school and they're working with to do that, then it's slightly different. But if you're open and you've got a licensed capacity, and you just happen to be in a school facility, then you would be eligible for the first one.
Okay, and this is similar, but really just more about the rules for providing that. Would a public school offering no-cost childcare only through the duration of the school calendar year through May 29th still have to be licensed as a childcare center?
So there's guidance on that. It depends on sort of who's staffing it, how many days. So what I would say is for that particular question, that you could email it to the superintendent at doe.virginia.gov, and then we can follow up and make sure you have the most accurate guidance depending on the context.
If we're trying to provide care, do we need to have a certified food manager on site?
So I think that we've provided quite a bit of leniency in terms of our regulatory requirements, and I think that, again, for the sake of ease, I mean, we want as much as possible people to give balanced meals and things like that, but I don't know that we would require that at this point for this particular time frame. I think that getting them fed is probably more of a priority.
Mm-hmm. And I think I just want to make sure we note on here, I think you all have a terrific memo that went out about the areas of leniency for folks to consider. We may just want to make sure that we get that, URL or be able to help people connect to that just to get that type of information, Tara.
Right. So if they go to the website, we have all that stuff listed, and I think it's on this particular slide that you have up at the first dss.virginia.gov with under the COVID site. I think all of our correspondence is listed there, and it should be listed as child care leniency, I think, or child care waivers, and under our recent updates.
Perfect. Thank you. I would point folks to that. I think it was a super helpful guide. How can I get the word out that we're available to emergency personnel and that we're open 24 hours? Wow.
Wow, open 24 hours. We like that. Again, Child Care Aware is the vehicle that we're really depending on to get the word out and make sure that those types of things, there people call to get information on that. So I would start with Child Care Aware and making sure that your information is updated with them.
Excellent, thank you. Are there any plans to help fast track or expedite for any child care providers who are unlicensed that are willing to become voluntary or licensed?
So we do have, and I think that's on our website as well, we've lessened the requirements for licensing on several fronts, and I won't go into all that for the sake of getting it wrong, but there's quite a few avenues that folks can become licensed. And again, because we have the leniency now, we have expedited processes for several different program types under our programs.
Okay. Thank you. If a center is open and willing to accept children of essential personnel, do parents still pay for service at the same rate we offer, or is the state subsidizing their costs?
Jenna, I'll defer to you on that one.
Yeah. So I think there's no expectation that these dollars need to be used to subsidize for, any individual or any families. So, if families are eligible for subsidy and happen to be, essential personnel, then those families are, and the state's covering the cost of the care. Some states have, sort of done some direct eligibility for essential personnel. I think, we were hesitant to go down that route, noting that again, it goes back to this fundamental question of who is and who is not essential personnel, and we have folks that are required to work, and again, it just becomes a very complicated question very quickly. So the state is providing funding to those programs that are open, and the decision on how programs charge remains up to them. So if you wanted to use these resources to reduce the rates, that you could, but there's not a requirement nor an expectation that you use it in that way.
What do we do if the application comes back stating it's incomplete but without an explanation?
Well, I think it would depend on the explanation. So if you have specific questions, again, go to that Ask for Care at DSS, and we'll try to get your questions answered if there's something. Obviously our goal is to try to help as much as possible to get these funds in everybody's hands. So a lot of what we're seeing now again is where there's some things that just aren't legible in terms of the folks who may be taking pictures or something like that. So I don't want to say that we haven't turned anybody down yet, but I don't think any of those necessarily approval letters have gone out. So they may be, sending stuff back saying it's what you need, but if you're having issues, just do that Ask for Care at DSS, and we'll try to answer as best we can.
Thank you. Can you speak to whether DSS will be lenient regarding some licensing regulations? For example, does it apply to CPR, first aid, MAT training?
So yes, I think those were definitely part of our requirements. I have to go back and check the CPR in first. And I think what the issue that we've seen with folks is that they have had things, maybe if they've expired within this pandemic time, for lack of a better word. And I know that's going to be extremely difficult for folks to get. We've had folks go online to renew, which is typically not something we would do, but I think we've got folks that are doing that now. And so we're kind of allowing that during this time. So we're definitely being lenient in areas that we weren't before.
Okay. Thank you.
But check out that leniency list. So that's, that pretty much gives a broad scope of what we have included in that.
Very helpful. Just have time for maybe a couple more questions before we round this up. You all have been terrific to answer so many rapid fire questions. Can the CARES grant funds be used to help an essential worker to pay for childcare, or are funds primarily for COVID related expenses at the center?
So I think there's a lot of flexibility there, right? I mean, and that was the intent, and that's how we expressed it to the governor. And so in partnership with Commissioner Storer and Tara and the team, it is for what a program deems important, during this time, just because, and that reflects what we had heard over the course of the last few weeks, which is very different needs from different areas of the state, but that sort of almost uniformly folks who were remaining open, had these needs. So cleaning supplies to sort of reduce sort of charges for parents, to provide hero pay or kind of a better connotation of hazard pay, any of those things, it can be used. And you other than such as is, you won't hear from the state that kind of, here's we expect you to use it, because we really heard from you that you needed flexibility here.
Mm-hmm. Thank you. I do want to say before we close up, we're getting so many comments of thanks and recognition and appreciation, Jenna and Tara, for all that this state is doing. So just definitely want you to hear that. I think we'll end with one last question that is being repeated through here about what about background checks, fingerprint, and portability and rechecks? Anything that you can say about that?
Jenna, I'm going to let you take that one.
Sure. So I think that's certainly come up, and I think we are working right now. The list that Tara talked about really represents sort of a balancing act of how do we keep kids safe, but also provide maximum flexibility within the regulations. And so, the commissioner has the ability in a state of emergency, or has the authority to waive some of these things. Ultimately want to keep kids safe, right? But also want to provide flexibility during this very difficult time. What he can't waive is anything that's in code or law. And so, background checks is something that, because of the private nature of it, right? It's a very private thing for people. It's all kind of covered in code. So he can't sort of fix that or provide that portability, even during a state of emergency. There is work underway, and there's some language and some of the budget language to potentially provide a little bit of relief and flexibility that, if it gets passed by the General Assembly later this month, that I think that Tara and Craig and I would have more guidance on the field. So we, trying to figure out, without putting any kids in harm's way, how to provide a little bit more flexibility is something that we're working on. We just can't do it immediately, because things that are set in law by the General Assembly, a governor or a commissioner can't just overrule, even in the case, or waive, even in the case of a state of emergency. Does that sound like a right answer, Tara?
Yeah, and I think there's a little bit of flexibility for new hires in terms of, if we have somebody who's, we know that's going to be coming on board that hasn't had a background check, and if there's been we've had a couple instances where we've had field print offices that have closed due to the pandemic. And so we're allowing some flexibility there if they work or are supervised by another person who has a completed fingerprint background check.
Great. Thank you so
Perhaps
much.
a little
Tricky question to answer, but appreciate that. I think that it's going to be hard to close this session. We still have so many questions, but I want to repeat a comment that's come across that I think sort of sums up the importance of this conversation. I want to thank Governor Northam for recognizing child care providers as essential workers. It's a trying time. Jenna, you want to close with a comment just to wrap us up around this information?
So yes, Cassie. So thank you, Kathy. Thank you for everybody on the phone. I see we still have over 400 folks on the phone. We know folks are busy. We know folks are stressed. We are, we're going to remain humble and nimble and want to keep hearing from you as we try to figure out how to support you to respond. But know that it is your work that we recognize as we went to the governor and said we need to sort of get these resources out to folks expeditiously. And we remain committed to hearing you, listening to you, and figuring out how we can support you during these difficult times with every dollar and every resource we can get our hands on. So just a note of appreciation as we go into the weekend. Thank you. Take care of yourselves, take care of your families, and know that we are in it for the long haul and remain open to figuring out the best in multiple ways that we can support and help you.
Thank you, Jenna. Thank you, Tara. And thanks to all of the many attendees who spent time with us this afternoon. Best to everybody and have a terrific weekend.